Welcome to Combos from the Couch by LifeStance Health, where leading mental health professionals help guide you on your journey to a healthier, more fulfilling life. Hello, everyone, and welcome to Combos from the Couch. I'm Nicolette Lianza, and on this episode, I'll be talking with Dr. Blair Scribner-Weiss, and we'll be talking about what is healthy aging versus dementia. So great to have you on, Blair.
Thank you.
Tell us a little bit about yourself and what drew you to a specialty working with older adults.
Sure. So I'm a clinical neuropsychologist and I work at LifeStance Health at a location just outside of Philadelphia. So that means that my job is to look at thinking abilities like memory, attention, language, and sort of see how those change across the lifespan. In terms of a little bit more about myself, I was raised as an only child. I was born to older parents. So I really spent most of my life around aging populations. So this wasn't too much of a stretch for me. I became interested in neuropsychology overall when I was a teenager. And I think sort of the pivotal point for me was when my father was diagnosed with Parkinson's disease. I was in college, and that really cemented my desire to work with older adults and really focus in on neurodegenerative disease. I would say that that lived experience, it's a guiding principle of my treatment, having seen things both from the clinical side, from the patient side, and understanding those dynamics and those challenges.
My gosh, so you definitely come to the table with lots of experience.
Yeah.
For sure. So can you explain the difference between healthy cognitive aging versus concerning cognitive changes?
Yeah, absolutely. That's what I do. So let's start with healthy cognitive aging, right?
Mm.
Our brains, our thinking abilities, they do gradually change as we age. And it's a lifelong process, and it's a completely normal and healthy aspect of aging. In that context, some aspects of our cognition, our thinking abilities, they do decline as we age. And this is not a comprehensive list, but it's things like divided attention, processing speed, that's how quickly our brain processes information, some aspects of memory, but also some aspects of cognition in normal aging remain stable or even improve as we get older. And these can be things like wisdom, our vocabulary, those both improve as we age.
Okay.
And I want to stress, these changes, they're considered normal. They're on par with healthy cognitive changes that your same age peers should be experiencing. And to answer your question of when are those changes to cognition concerning,
Mm.
that would be when our thinking difficulties are greater than expected for our age. And this can look differently for different individuals depending on what factors are driving that change. And now we're getting more into the realm of discussing things like mild cognitive impairment or dementia.
So that's a good thing to kind of lead into. So can you please break down the key characteristics of mild cognitive impairment versus dementia?
Absolutely. So we already discussed normal cognitive aging, right? So these are the changes to our thinking abilities that are on par with our peers. So let's then go into mild cognitive impairment, or MCI. So with MCI, mild cognitive impairment, essentially there have been changes to our cognition, but they are greater than we would expect given our age. However, these changes are mild enough that people can live independently. They can complete their daily activities, things like financial management, medication management, driving, and they can do those things with either no changes or pretty minimal changes. And let's then talk about dementia a little bit. So when we are diagnosed with dementia, that is saying that the changes to cognition that we have experienced, they're more severe. And in fact, they're so severe that they can significantly impact our ability to complete those daily activities that I mentioned. And in some cases, it can impact our ability to live independently. Now, dementia is really an umbrella term. That is to say, there are many different neurological processes that can lead to a diagnosis of dementia.
I don't think people really understand that. I think it's just kind of gets put out there as like one lump there, but
Mhm.
it's many different that it can
Yeah,
fall under. It's an umbrella term, like you said. Yeah.
yeah, exactly. And most people are familiar with the most common type of dementia, which is Alzheimer's disease.
Hmm.
That's the one everyone hears about. But there are other causes of dementia. We can have things like vascular disease, mixed etiology, frontal temporal dementia, dementia with Lewy bodies. Parkinson's disease actually has a type of dementia associated with it. And each one of those disorders, they have their own unique pathologies and clinical presentation that can impact sort of the symptoms and the course of those symptoms. Most people do would meet criteria for a diagnosis of MCI before they would meet criteria for a diagnosis of dementia. And there are exceptions to that, of course. But just a few things I'd like to highlight is that not all patients with MCI progress to dementia.
Okay. Something that I think another that people don't realize that it's almost
Yes.
like an automatic that you do, but you're saying
Mm,
that's not necessarily the case.
yes.
Okay.
You can have dementia, you can be stable, or sorry, you can have MCI, you can be stable with MCI for years without
Okay.
significant decline. And some people with MCI can actually improve over time depending on what is driving those changes.
Okay.
MCI, it does increase the risk for developing dementia, but not all older adults develop MCI or dementia. In fact, most don't.
Okay. Interesting.
Yeah.
Again, I don't think people realize that.
Mhm.
So thank you for helping us understand that.
Sure.
What are some helpful strategies you recommend for maintaining cognitive health as we age or decreasing the risk of dementia?
Yeah. So that's what I love to talk about, right? So we can't prevent a dementia process from taking place in our brain, but we can reduce our risk of developing it.
Okay.
So sort of the main thing to think about when thinking of preventative strategies is if we keep our body healthy, it's going to help us keep our brains
Good
healthy.
point.
Right.
Hmm.
So these are things that you probably already aware of, but I'm going to highlight them anyway. Managing diagnosed conditions that you already have. So things like cardiovascular disease is a pretty big risk factor. So managing conditions appropriately, like high blood pressure, high cholesterol, diabetes, obstructive sleep apnea is a big one. Please wear your CPAP. Managing things like liver or kidney or thyroid disease. Also, modifying things like alcohol consumption and reducing or eliminating things like illicit drug use, tobacco use. We want to keep our bodies physically active, as is recommended by our doctors. Don't just start a brand new exercise regimen, just
Right.
as I told you
Right.
to. Um, Heart healthy diet. There's been a good amount of research that's come out about the benefits of a Mediterranean style type of diet.
Mhm.
Also, managing things like mental health, depression, anxiety, PTSD, making sure we're getting those conditions managed. Sensory impairments, things like hearing loss, vision loss, making sure we're taking care of those. And my favorite thing to talk about is lifestyle factors. So, keeping our brains mentally
Yeah.
active, reading, doing puzzles, creative
Mhm.
outlets, take that painting class, try
Yes.
learning something new, audit classes online from local
Yes.
colleges.
That are often free for
Yeah,
older
exactly.
individuals.
There are
Yeah.
so many free programs in your neighborhood. If you
Yep.
go to your county's website, you'd be shocked about how
Yes.
many things there are to do. And,
Yes.
you know, again, in that context, keeping yourself socially engaged, right?
Mm.
Spending time with friends or family, attending groups and events, all of these things keep your brain active, keep your brain engaged, and are going to decrease the likelihood or rather decrease the risk that we're going to develop a neurological disorder such as dementia.
Mhm. What should someone do if they notice cognitive changes in themselves or a loved one?
It's a great question. You should go to your doctor,
Mhm.
right? If you're not sure where to start, you can always go to your primary care physician. You should have a primary care physician, especially as you're getting older, because more conditions come up as we age.
Right?
That being said, if you're already seeing a specialist, if you're already seeing a neurologist or a psychiatrist, a cardiologist, even a psychologist, they can, if you bring your concern to them, they can give you more information and let you know if they think further evaluation is warranted. As a neuropsychologist, I'm typically someone that you get referred to, having talked to someone else first. But if you come to see me, I'd be happy to see you.
Any other takeaways you'd like to share?
Let's see. I guess just to emphasize that changes to our thinking abilities as we age, these are normal. But if those changes feel more pronounced than your peers, there might be something else going on. So contact your doctor, ask for help, and don't forget to keep your brain and body healthy as you age.
I think that's the key right there for sure. My
Right.
gosh. Thank you, Blair. Thank you for this amazing conversation. Very helpful.
Absolutely. It was nice talking with you.
You too. Thank you.
Bye.
I'd also like to thank the team behind the podcast, Jason Faden and Juliana Whitten, with a special thank you to Jason, who edits our episodes. Thank you for listening to Converse from the Couch. Take care, everyone.